tulina amalwaliro matono okusinziira ku bantu abali mu Buhweju. Buhweju tulina abantu abali mu mitwalo 4 n'omusobyo. So n'amalwaliro ge tulina amalwaliro matono agali ku health center 3 galinga amalwaliro 9 naga health center 2 agaliwo. Obwetaavu bungi okusinziira ku kyakoze eki kukiweerezebwa oba kye tuli mu kuweereza.
People have issues in their houses. People are sick. Sometimes they are there, they don't even want to go to the hospital because they feel they will not get what they want. Others, because of poor network, they feel they don't have money to take them to the hospital. So sometimes they remain there with their sicknesses.
As leaders, we need to appreciate that our hospitals, our health facilities are not very well equipped. And it is a national problem. It may be worse here in Buhweju, but it's a national problem. I have seen on your televisions, you broadcasting the National Referral Hospital in an emergency state. The facilities are not well equipped, but too, the distance itself. People have walked over 25 kilometers to come here. And for me, that is a clear sign that there is no medicine in the hospital. And therefore, now that there is free medicine here, free treatment, you see people coming in huge numbers. We must equip our health facilities. Because people will not go to school, people will not go to their gardens, people will not do anything if they are not healthy. And therefore, it's a challenge on us, it's a call on government to prioritize the health sector.
Ngaye mulabye abantu wano abasinga bazze wano bazze nga bazze okufuna obuweereza obw'enjawulo. Ate buno obuweereza kati wano mu kibangirizi kyaffe kino buweerezebwa Mbarara Regional Referral. So oteeka eddwaliro eya General Health Center mu nsika nga wano kiyamba nti abo bonna abaagala obuweereza obwo bajja ne babufunirawa ku nsika Health Center ko. Ate nekyo kiyamba nti kyongera ku basawo abawa obuweereza buno. Babanga kati abasawo abaliwo abali mu General abali mu Health Center 4 ne Health Center 3 batonoko.
Sometimes we speak as parliament by the implementers. The initiators of our national priorities have different priorities. And that's why, whereas we think as parliament that the health sector should be prioritized, it is not prioritized. And in the current state of doing things, parliament may not do much if government is not interested in prioritizing the health sector.
2018, when we were in Orishange, the people of Buhweju, led by their leadership, requested us to come to Buhweju because of its unique nature. There's basically there are few services that are being offered by government, so we have come here to complement the government services in the medical field. So we are here to respond to the call of the leaders and also to do our annual medical camp as AMDA.
AMDA is an association formed in Mbarara, and there are people who live and stay and work around Kampala. They have brought us this medical camp to treat our people. And the people that they are treating are not only Catholics, they are all of all religions. And people at the end of the day, I think they will get life in terms of health, in terms of spiritual.
usanga umuntu yargana ashasha bagira ngo ubusasho tubakukibira akarwara gacika munonga konka kuruya hari hebyomo byana bamurago baryaha bambara bona baryaha kano mbyaro mu buheza no babutari
tugarukati ko mwirwaro umwoshanga emibaze tari mu mwirwaro oshanga abantu nubabuzabuziga batine buhereza bukumara konka amadakuyiza hizobere twarebo buhereza ngo babwine konkito kunenyo masitugizere tubwine
That is also not only in the branch of education, where you can choose to go and you become successful. 20% Yes, NSSF, we still appreciate you for your great support. Let's say go. Sinaba aliki omulingo yona. Yes. Alijo muzimagwe okakwatengena amagana batahibe. Nabalijo so nabalijo kandi olekisina yawe kana yakukama bawe Buhweju na bakase sakufunga abakristo mabito
Money. Why don't you prioritize the health sector?
Não, cara, me deu.
Access issues because of the geographical terrain, and because of that the health burden is really still high because of the access challenge. Very many people within the community are there, they need particular services but they can't reach out to get these services, and even those few who come to our facilities and get these services, they get to a certain limited number as according to our structure, because the highest level of the services you can offer in Buhweju at health center 4 level. So realize that those who might need specialized services like ophthalmic services, orthopedic services, etc. cannot get them because of that challenge. Therefore, the need is still high for services within Buhweju. Demand superseding what we have available. That's what brings in this challenge, that at a certain point, when these drugs are supplied at our facilities, they supply them in a quarterly manner, in cycles. So that way it means that people can stay within communities sick, and when they hear that yes, drugs have been brought on board, they come to our facilities. We treat them, they utilize these drugs, then we have a challenge midway there. Do some redistribution from other districts, but still it's not enough to cater for the demand. So once an opportunity like this comes up, still it serves well for our people to come and they get the drugs available.